Hey, and welcome to this episode of Ask the Diabetes Coach. This is Dr. Brian Mowll, the Diabetes Coach. I am a master licensed diabetes educator, certified diabetes care and education specialist, and IFM certified in functional medicine. And today I'm answering a question from Kurt. This is from one of our webinars that we did recently, and Kurt says, what is the best way to deal with statin-induced type 2 diabetes? Is there any way to reverse the process due to long-term statin use? And is there any real investigative research on this matter that I can read up on? So, Kurt, that's a great question. So I'm going to be going through that with you right here on this video and hopefully giving you a good answer. So first of all, what is a statin medication? There are many different types of statins, but statin is a class of drugs that work to lower cholesterol levels in the blood by inhibiting an enzyme called HMG-CoA reductase in the liver. So when you take a statin medication, it gets absorbed into the GI tract, goes to the liver, and it binds to this enzyme and decreases its activity. This then in turn decreases the production of cholesterol in the liver and decreases the LDL cholesterol weight, which is a blood test that's often run as part of a standard lipid panel. The theory is that high LDL cholesterol contributes to the atherogenic process, the plaque building up in arteries that can lead to cardiovascular disease and events. Unfortunately, statins also come with some side effects. So they interrupt the production of coenzyme Q10 by inhibiting the production of mevalonate, which is important in the synthesis of CoQ10. So you get lower CoQ10 levels, and CoQ10 is really important for muscle function and mitochondrial activity. Statins have also been shown to directly impair the function of mitochondria, and mitochondria are really important for the energy production in our cells, including muscle cells. So one of the things we see with statins is oftentimes there is myopathy or muscle problems, such as muscle pain, weakness, and even muscle damage. I, in fact, had a patient years ago who had severe muscle damage from statin use, from atorvastatin, and ended up having to use a walker for the rest of his life. One of the other problems with statins is that they are associated with a higher risk of diabetes. They can make diabetes worse and increase the risk of diabetes development. Studies have shown that statins can lead to insulin resistance, where the cells, like the cells in the liver and the muscles, especially the muscles, don't properly respond to insulin, and that leads to an insulin resistance, which raises blood sugar. They can impact insulin production at the pancreas, and they can interfere with glucose utilization. One study published in the Lancet journal showed about a 9% increase in diabetes risk from statin use. Another study published in Diabetes and Cardiovascular Disease showed that statins have been associated in many studies with new onset diabetes and a whole host of other side effects. In their conclusion, this is what they stated. With the widespread use of statin therapy, the adverse effects of statins have become of increasing interest. An increased risk of new onset diabetes has been demonstrated in a large number of trials. In addition, myo or muscle toxicity, increased liver enzymes, cataracts, mood disorders, dementia, and peripheral neuropathy may be associated with statin treatment directly or indirectly through increased risk of diabetes. So certainly statin drugs do have their risks. Now, they also have benefits, and I think it's important to weigh the risks and benefits, but oftentimes the risks are largely ignored by prescribing physicians, and we need to be careful with that. Statins should not be, as some people suggest, put in the drinking water and are not good for everyone. We have to weigh the risks and benefits. In my opinion, I think there are cases where statins can be helpful. People who have a high amount of LDL particles or a high amount of small dense LDL particles, which can lead to arterial plaques and increase the risk for cardiovascular disease. If those lipid patterns can't be changed, people who have a high apolipoprotein B to A1 ratio, people who have very low HDL and high triglycerides, these are all patterns of poor metabolic health. And if you can't change those patterns with diet and lifestyle intervention, which most of the time we do see those patterns change, but if you're not able to do that, then statin therapy might be the best way to protect yourself against atherogenesis or arterial plaques and cardiovascular risk. But again, we do have to weigh those benefits with the risks, and there are certainly risks of myopathy, elevated liver enzymes, and new onset and worsening of type 2 diabetes, insulin resistance, and high blood sugar. So for the second part of the question, what do we do about it? I think it's important, if you are on a statin, to be supplementing coenzyme Q10. There are a number of studies that show 100, 200, 300 milligrams of CoQ10 supplementation with statin use can prevent a lot of the muscle damage and may help support mitochondrial function. I think if you're going to use statins, it's a good idea to cycle your statin therapy so you're not always on statins. You give your liver a break, perhaps 2 months on, 1 month off, or 10 weeks on, 2 weeks off, something like that, to give your liver a break. And there are different statin medications, so you don't have to use the most potent statin drugs. There are also statin alternatives. There are drugs that lower triglycerides. There are drugs that lower cholesterol absorption in the gut. There are the newer PCSK9 inhibitors, which also can help to lower LDL cholesterol and in turn reduce cardiovascular risk. If you already have damage from statin use, then you're probably going to want to find a different type of therapy and not use statins. Make sure you are supplementing coenzyme Q10. Alpha lipoic acid can also be helpful. Benfotiamine, which is a fat-soluble B1, has been shown to help. PQQ can help with mitochondrial genesis. Exercise in the form of walking, high-intensity interval training, and resistance training can also be helpful to rebuild lost or damaged muscles. And absolutely, you want to work on metabolic health, keep your blood sugar down, reduce insulin resistance, improve circulation, and stay as metabolically healthy as possible with a good diet and lifestyle. All right, Kurt and everybody else who's watching, I hope you found that helpful. This has been Ask the Diabetes Coach with Dr. Brian Mowll. If you want to learn more from me, or maybe you want to catch one of my live webinars, make sure you look in the description of this video. There's a free guide that you can download called the Blood Sugar Manifesto. When you do that, you'll get on my email list, and I'll let you know about my upcoming live webinars that I have, and you'll have a chance to get some of these questions answered as well. You can also put a question below this video related to this topic or something else, and I'll try to answer those questions on future videos as well. If you like this content, please make sure to give this video a thumbs up and subscribe to the channel. The more subscribers we have, the more views we get, the more we can help people. And also click that little bell for notifications there so you don't miss any of my new videos. All right, again, this is Dr. Brian Mowll, the Diabetes Coach. Thanks for tuning in, and check out some more of the content on my YouTube page. Take care.